This is Kenema Government Hospital in Sierra Leone. It used to be an Ebola treatment center, but it had enough problems as it was. It was connected by gravel pathways, and the nurses' station was perilously close to an area where Ebola patients were held, with only a flimsy barrier to separate them.
When I go to Kenema, it's just the shock of my life. I walked inside the main ward, close to about 6 dead bodies inside body bags, just laying all over the place. About 7 nurses there admitted inside the hospital, inside the care center. I think the way I see now just a complete breakdown of systems. I think the WHO, not for blame anybody for anything, but WHO could really spend a little bit more time and Kenema.
A new investigation is putting the blame on the World Health Organization for failing to handle the outbreak. It says WHO's disorganization had some very dire consequences in terms of loss of lives that shouldn't have been. Health workers at the center revealed that apart from lacking basic protective equipment, there were also incidences of flawed procurement of key elements such as chlorine used as a disinfectant at the Ebola treatment center.
That chlorine had already expired for 1 year, but by that time, the WHO was already here.
From MSF, they can't test the chlorine when they test them.
When you are in there and when you come out, you perspire a lot, everything, nothing to drink. So except we complain a lot. Later, they started coming with water for us.
WHO has refuted the investigation uncovered by the Associated Press. It says its staff were hampered by poor management, lack of basic protective gear and bureaucratic infighting. It also argues that resistance from locals was a more powerful driver than any mistakes by WHO or anyone else. Kenema was identified as one of the 2 priority areas in July 2014. Sierra Leone has lost more health workers than any other country affected by the virus, with more than 40 dying in Kenema. Catherine Ogunde, CCTV.